We have a fully functional office in Lviv and are setting up an operational base in Dnipro in East Central Ukraine to mobilize resources more quickly and reach some of the most vulnerable people in conflict zones with urgent supplies. Given the uncertainties of the current situation, there are no assurances that the war will not get worse. WHO is considering all scenarios and making contingencies for different situations that could afflict the people of Ukraine, from the continued treatment of mass casualties to chemical assaults. Our second priority is to work with Ukraine's neighbors, with countries across the entire European region and beyond, to ensure that the health needs of those fleeing the war are met, treatment and care for refugees with special needs are maintained, and the health systems of host countries can manage these large influxes of people. So far, more than 4.2 million people have fled Ukraine since the 24th of February. I warmly thank the destination countries across the region for their commitment to extend health services to those arriving, but acknowledge that providing this is challenging and stretching already overburdened systems. We are working with national authorities to bridge gaps and help deliver supplies where needed for services such as routine childhood immunization. WHO is also coordinating with the European Union to triage patients arriving to make sure that they are received in an EU country that is best placed to treat them. We are channeling support from further afield. The Asia-Europe Foundation has provided $9.5 million from Japan to procure much-needed equipment and provide services to manage COVID-19 as well as communicable diseases, including measles and polio, for Ukraine and its neighbors. Thirdly, we are supporting the Ministry of Health to rebuild Ukraine's health system back better. WHO is preparing now to redeploy teams throughout the countries as access and security improves. We are committed to work through a strong, decentralized footprint, both during the current humanitarian response, but also to be there with local and national authorities to rebuild the war-torn health system. Health requires peace. Well-being requires hope, and healing requires time. I speak on behalf of the entire WHO family when I say that it is my deepest wish that this war comes to an end swiftly, without further loss of life. Tragically, this is not the reality we see. As of today, WHO has verified 91 attacks on health. Routine immunization coverage for polio and measles is below the threshold for population immunity. 50% of Ukraine's pharmacies are presumed closed, and 1,000 health facilities are in proximity to conflict areas or in changed areas of control. Roughly 80,000 babies will be born over the next 3 months with insufficient pre- and postnatal care available due to the war. We have prepared for different eventualities, anticipating that health challenges will get worse before they get better. But as WHO's long history and experience shows, they will eventually get better. The life-saving medicine Ukraine needs right now is peace.